Good morning, Tracer Man. Today I want to talk about type 2 diabetes, specifically some tips on how and what to eat if you have been diagnosed with diabetes type 2. Before we talk about what foods to eat or avoid, let's first review what we previously learned about type 2 diabetes. Type 2 diabetes is the most common form of diabetes. It used to be called adult onset diabetes, but it can occur at any age, even in children. Although it's a serious condition that won't go away, you can learn how to take care of your diabetes and live a healthier life. The main causes of type 2 diabetes are: one, it's a condition called insulin resistance, which means that your body has trouble using the insulin it produces. Or the second one is not making enough insulin to prevent insulin resistance. The risk factors for type 2 diabetes are: one is genetic. People with a close relative with type 2 diabetes are at a higher risk. Ethnic background, for example, the actual prevalence of diabetes in the Caucasian population of the United States is about 7.2%, while in the African American population it increases to about 11%. In a well-known group of Native Americans, the Pima Indians, the prevalence increases to about 35%. Birth weight is another risk factor. There is a relationship between birth weight and developing diabetes, and it's the opposite of what you intuitively think. The lower the birth rate, the higher the risk of type 2 diabetes. Metabolic syndrome. People who have the metabolic syndrome are especially high risk for developing diabetes. This is a family of related disorders which lead to diabetes, such as being overweight, having high blood pressure, having high cholesterol, no exercise, etc. And the last risk factor is obesity. Obesity is probably the most impressive risk factor. This is in part due to the fact that obesity increases the body's resistance to insulin. Now that you know the risk factors, you might ask if there's anything that can help prevent the onset of type 2 diabetes. The answer is yes. One of the most important factors in the development of diabetes is genetics, which we have no control of. However, there are things in our environment we can control to lower our personal risk of developing diabetes. And frankly, none of it is magic. Here are some things to think about. One is exercise. It is true, exercise is good for you. Exercise is thought to be a major deterrent of insulin sensitivity in muscle tissue. By increasing exercise, the body uses insulin more efficiently for up to 70 hours after the exercise period has occurred. Thus, exercising 3 to 4 times per week would be beneficial in most people. Next would be weight loss. In patients at risk for diabetes, weight loss can improve insulin sensitivity, delay, and even prevent progression to type 2 diabetes. Next is smoking. Smoking more than 20 cigarettes a day can increase your risk of developing diabetes to more than 3 times that of non-smokers. So there's another reason to quit smoking. Next would be nuts. Nuts and peanut butter consumption show some protective effect against the development of diabetes. A suggested 5 1-ounce servings a week of nuts and or peanut butter can make a difference. And finally, medications. There are a number of medications on the market to help prevent type 2 diabetes for those at risk, as well as medications for those who already have type 2 diabetes in helping to manage the disease. Your doctor can assist you in determining whether you need medication, and if so, what type. If you are at risk for developing type 2 diabetes, or if you have been diagnosed with having type 2 diabetes, keeping track of your diabetes ABCs will tell you if your diabetes treatment is working. The ABCs of diabetes and the targets suggested by the American Diabetes Association are: A, the A1C, or estimated average glucose test, should be 77% or less, or should be below a number of 154. B is blood pressure, which should be below 120/80. And C would be your cholesterol levels. Total cholesterol should be under 200. Your HDL number for men should be about 40, and for women it's about 50. Triglycerides should be below 150. A couple of years ago, my doctor told me my blood sugar was high and suggested I was borderline diabetic and recommended medication to lower it. However, I did a little research and realized that I could have an impact on my numbers with a few lifestyle changes rather than medication. That began my journey of changing some of my eating habits, adding more exercise to my daily activities, and losing a few pounds. I'm pleased to tell you that my efforts have paid off. I've lost about 25 pounds over the past year and a half, and I've increased my exercise to a minimum of 3 times per week, and my numbers are now within acceptable ranges. And I attribute that to changing some simple lifestyle habits, eating healthy and exercising more. I now eat healthier than I ever have, and I've seen positive results because of some of those changes. I can't tell you it was easy, but I can tell you that if you make up your mind to it and stick with it, the results can be positive. If you have not been diagnosed with type 2 diabetes, but if you have any of the risk factors for diabetes, I hope this review provides some information to those of you wanting to make healthy lifestyle changes, and that it encourages you to open up a dialogue with your doctor. Type 2 diabetes is a serious disease, but it is manageable and oftentimes preventable. A few simple lifestyle changes can truly make a huge difference. Let's take a break here at Trees for Man, and when we come back, I'll share with you some of the foods to eat, some of the foods to eliminate, and maybe some hints to help you change some of your existing recipes so you don't have to throw them out. We'll be back in a few minutes. Healthy eating for type 2 diabetes is about preventing dangerous spikes in blood sugar. Here are a few tips on how these 9 foods can help. 1 are beans, such as black, white, navy, lima, pinto, garbanzo, soy, and kidney. Oatmeal is another one. Fish is a good food to eat. Non-fat yogurt. The Greek non-fat has twice the protein as other brands. Almonds. Non-starchy vegetables such as broccoli, spinach, mushrooms, peppers. Wild salmon, egg whites, and avocados. Eating a healthy diet isn't just about choosing the right foods. It also means avoiding foods that can spike your blood sugar and increase your risk of diabetes complications. Here are a few foods to avoid. Sugary foods such as sodas and sweets and desserts, fruit juices, dried fruits, white rice, bread, and flour, full-fat dairy such as whole milk or cream cheese, fatty cuts of meat, packaged snacks and baked goods such as chips, cookies, donuts, fried foods such as French fries, chicken, potato chips, and alcohol. Knowing what foods to eat and are just as important, what foods to avoid will go a long way in helping you to make the transition to a more diabetic-friendly cuisine. However, there's no need to toss out your favorite recipes after type 2 diabetes diagnosis. Start with some of these easy changes. One would be to experiment with healthier cooking techniques. Instead of frying things, one of the best ways to start is to use non-frying methods of cooking, stir fry, bake, or poaching instead of frying or sauteing. Second, cut out the fat. Replace saturated fats, namely butter and lard, with olive oil or canola oil when some type of fat is needed. Try also skim milk instead of whole milk, fat-free cream cheese instead of regular varieties, and fat-free yogurt when a recipe calls for sour cream. Lemon or lime on fish and vegetables is much healthier choices than butter or sauces for people with type 2 diabetes. Third, make sugar substitutions. Try some of the varieties of artificial sweeteners such as Splenda to replace sugar in the recipe. Instead of sugar in baking, try adding spices such as ground cinnamon or adding vanilla extract. Stash the salt shaker. Flavor your foods with herbs and spices instead of salt. Try garlic salt to slash the amount of sodium. If you must use regular salt, opt for sea salt. Another option, if a recipe calls for a teaspoon of salt, use a half a teaspoon and substitute fresh herbs for the missing salt. Next, go with whole grains. Refined grains such as white bread, white rice, and white pasta are not good choices for people trying to stick to a diabetes diet. So make brown rice instead of white rice and use whole grain bread for sandwiches. If you're craving spaghetti, buy whole grain spaghetti. My husband and I have switched to that and we actually like it better. Choose cheeses wisely. Cheese is loaded with saturated fat, but there are ways to make cheese better for a diabetic diet. Use a strongly flavored cheese such as a sharp cheddar instead of American or Swiss. Prepare healthy meats. Use skinless chicken and lean cuts of meat, for example. If you like bacon with breakfast, consider substituting for a Canadian bacon or turkey bacon to reduce the fat. Make your burgers with extra lean ground beef, ground chicken, or ground turkey. Reduce your portion sizes. To prevent weight gain and out of control glucose levels, cut your portion sizes. When dining out, resist the temptation to finish those generous servings. Instead, ask for a container to go and take half your meal at the beginning and put it into that and take it home with you and have it for lunch the next day. Transforming standard cooking instructions and old family favorites into tasty, diabetes-friendly dishes may take some time, effort, and creativity, but going the extra step in the kitchen will make sticking to a diabetes diet much easier. My suggestion would be to start with one change each week until you get where you want to be. As many of you know, my husband's one of those ho-hos and ding-dong kinds of guys, and so getting him to eat healthier this past year and a half has not been an easy task. However, I started out by just making a few of these same suggestions and substitutions over the past year and a half, and most of it has become now second nature for us. My husband is actually reading food labels now when we go grocery shopping. Well, wonders never cease. That's all I have for today. I hope that some of these tips will be helpful to you. Again, if any of you would like a copy of these tips, give me a call at the health department. I'm happy to send you a copy. Until next week, be kind to one another, be happy, and stay healthy.